Hi, my name is Ryan Phillips. I am a senior at the University of Missouri-Columbia, and this is my presentation on the healthcare quality and coverage for the LGBT community. LGBT is an acronym that stands for lesbian, gay, bisexual, and transgender. It is an umbrella term that is intended to capture all individuals who self-identify as something other than heterosexual. Not all members of the LGBT community identify themselves as lesbian, gay, bisexual, or transgender. There are numerous subgroups within this population, such as pansexuals, asexuals, bigenders, and cisgender. As of 2012, 9 million Americans self identify as LGBT. However, that number does not include individuals who participate in same sex behavior but still identify as heterosexual. An overview of their healthcare of the LGBT healthcare. Current research is aimed at explaining and assessing the healthcare needs of the LGBT population. However, it is still in the earliest stages. Because of this lack of research, little is really known about the specific health needs of LGBT individuals. However, that is rapidly changing. Healthy People is a governmental program that's designed to address the health needs of the American people in 10-year increments by establishing goals to be met in those 10 years. In 2010, Healthy People 2020 was established, and it included a new milestone by being the first of these 10-year plans to include goals for LGBT health. In 2011, an Institute of Medicine report established the first list of health disparities and barriers to receiving health care that have plagued the LGBT community for decades. Beginning in 2011, the Joint Commission has required all healthcare organizations that receive federal funds to implement a non discrimination statement as a requirement of accreditation. This is an exceptionally important step because many states require healthcare facilities to receive Joint Commission accreditation as a condition of being eligible for reimbursement of Medicare and Medicaid funds. Some of the needs and challenges of the healthcare or of the LGBT community, they experience the same type of health issues as members of the heterosexual community. However, the occurrence of some specific health issues are more prevalent in the LGBT community. Each subgroup of the LGBT community is faced with their own health care needs and challenges, which is important to note because a lesbian woman will have different health care needs than a gay man or a female to male transgender person will have. Many improvements have been implemented in recent years to address the challenges faced by the LGBT community, such as the Affordable Care Act. Challenges to the quality health care for LGBT communities still exist, however. In addition to being new, research into the health needs of the LGBT community has lacked focus on the subgroups within this community and tends to examine all LGBT individuals as a universal group. This lack of focus is problematic because not everyone will have the same health needs. Current issues in health include social stigma and discrimination that really has kind of profound effects on the health of the LGBT community. Some examples of social stigma and discrimination include violence. In fact, 46% of bisexual women are estimated to have been raped. 40% of gay men experience some form of sexual violence. For example, in 1998, Matthew Shepard was beaten, tied to a fence, and left to die in Wyoming as solely as a result of his sexual preference. The murder of Matthew Shepard is an important to note because it's really the first time in recent history that significant attention has been paid on a national level to the violence that LGBT people experience at the hands of people who hate them simply because of their lifestyles. Inadequate health care due to provider bias is also an example of discrimination. Many physicians are unwilling or unable to provide health care to members of the LGBT community based off their own personal beliefs regarding the lifestyle that LGBT people live. Um, LGBT people also have increased stress and anxiety. They have a higher rate of HIV and AIDS than heterosexual people. 28% of transgendered females are currently living with HIV, and 2/3 of all new HIV infections in the world are gay men or bisexual men. Substance abuse is also an issue. LGBT people tend to use tobacco, alcohol, and other illegal drugs more than their heterosexual counterparts. LGBT individuals also have higher rates of chronic conditions such as osteoarthritis and obesity. LGBT individuals also have a much higher suicide rate than heterosexual people. A 2011 survey of transgendered individuals revealed that 41% of them had attempted suicide. An important or an important case would be Tyler Clementi. In 2010, he committed suicide by jumping to his death off of the George Washington Bridge after his roommate in college had secretly videotaped him and his sexual encounter with another man and then posted that footage to Twitter as a way of discriminating against him. In regards to access to healthcare, barriers include negative attitudes exhibited by providers, which end up causing LGBT individuals to refrain from seeking medical care. The 2011 survey of transgendered individuals showed that 19% of them reported being refused medical care based on that provider bias. Poverty is also a barrier. 39% of all LGBT people earn $30,000 or less annually. Transgendered individuals are 4 times as likely to earn less than $10,000 a year as compared to non-transgendered people. Um, ability to acquire health insurance is also a barrier to health care for LGBT people, as well as their distrust of the medical system as a whole. Improvements to access to healthcare for LGBT individuals include the Affordable Care Act and the Supreme Court ruling in United States versus Windsor, which overturned key portions of the the Defense of Marriage Act. In United States versus Windsor, that was a Supreme Court case that was the ruling was issued in June of 2013, and basically that ruling required that the federal government to recognize all legal same-sex marriages. That ruling has provided access to numerous benefits for same-sex couples, including spousal health care coverage. However, that ruling only applies to the federal government. It does not require private companies to offer spousal coverage to same-sex couples. The ruling also expanded the benefits of the Family Medical Leave Act to all married couples regardless of their sexual orientation or preference. With the Affordable Care Act, it made widespread changes to the healthcare system for all Americans, but specifically for the LGBT community, there are 3 major changes that impacted their ability to access healthcare and how healthcare is delivered to that population. First, it increased access to health insurance coverage through the expansion of the Medicaid program and implementation of the healthcare marketplace. The Affordable Care Act outlaws discrimination against individuals because of their gender identity. However, it does not include sexual orientation. In fact, many states can still fire an employee just for being non-heterosexual. The Affordable Care Act also includes, for the first time, a provision calling for the collection of information and monitoring of the health disparities that affect the LGBT population. My final thoughts include that the healthcare quality of LGBT people is inadequate due to a number of factors, but specifically discrimination and provider bias, whether perceived or factual, and the lack of research into the needs of the community. Access to health care has been greatly expanded because of the Defense of Marriage Act ruling and the Affordable Care Act. However, these steps fail to eliminate all of the barriers to health care access. The years ahead really hold a great opportunity for our society to expand our knowledge regarding the healthcare needs of the LGBT community, especially due to the current shifts in public opinion.